ones that are connected. Thank you so much for your time. It's a pleasure to be here again with all of you, explain you a little bit more about this process that is really interesting and freezing. I know there were many of you that were subscribed to this meeting. Thank you so much for the registration, also for sending us your questions. Let us try to get deep into all the topics that we're going to discuss today, and of course give you more information regarding everything that is related to this important thing, that it's definitely fertility, and also all the topics that are related to how to improve the quality of the eggs. What can I do if I've got like a low MH and then I don't really know what to do? Let's try to focus on all those topics, and definitely, as the topic says, improve the ovarian response. So let's get to that point. So as many of you noticed, there were a few things regarding this part that maybe it would be interesting to see. So I prepared a few slides for you to have like a really good idea of how this is going to be today. I would like to definitely show you some strategies that nowadays we manage in terms of fertility, and also in terms of how clinics approach this, especially in Reproclinic. So in this case, I would like to idea of how we could approach your specific situation. So now we're going to speak a little bit more about how we're going to dedicate this. I think it is very important to like everything that we would like to. I would like to talk about definitely how we're going to manage the situation when you come to the clinic, when the doctor will start to see you and everything. So I hope that at least you can also see that we are fully committed to this point. The first thing that most of the patients ask is, how can I start? When do I start? So I would like to propose you this topic in a way that we can fully understand the whole process. And the main idea would be, why act now? So as you can see in the graphic, there's this line that decreases with the time, and this is more related to the age and also how the ovarian reserve goes down. This is because, as you may know, or many of you have done some research, this is more related to how women's body react to the time, and also the biologic process of menstrual cycles. And as also there's an important fact, many studies describe that every year that passes, also this ovarian reserve has some, let's say, limits, and we need to fully understand how it happens in every woman. Common cases says that it may be possible that, let's say, ovarian reserve has some age limit, and others say that it's more related to also the quality that the body has, the number of oocytes that is defined since the person is born. So there are a few hypotheses, and some of them are still on research. But let's stay on the fact that definitely what we know from all the research and the literature is that this decreases with the age. So this is a really important curve that I would like you to see, because this will be also some of the things that I will remind during the whole presentation. So the initial assessment is something that is really important. Sometimes many people ask, when do I have to start? And this is something that it's definitely important to understand when you are starting this fertility treatment, or even when you're starting to understand your fertility situation. Most of the times, many of the patients that contact us, they always ask us, which test do I need to get to understand or fully get a good idea of which is my status. So what I always tell them is that there are two most important tests. These are a transvaginal ultrasound. This ultrasound with the AFC, that is the intrafollicular count, give us a good idea of how many follicles there are in every ovary. With this information, supported with a blood test that is the AMH, okay, these two parameters give you a good idea of how we can contrast both of them in order to fully give you an idea of how many follicles and how many eggs we could predict to have during the whole treatment. So according to this, then we can see how we can fully assess and also plan your medical protocol. Finally, it is always important to understand that this is a medical procedure. So in order to give you a good idea of how we can do this, it is really good to also have a comprehensive assessment. This is important because everybody is different, every response is different, and sometimes it is necessary to also consider other factors. So what we always do here in the clinic is to offer all our patients a personalized plan, so they can always have an idea of how many how many eggs they could expect, how the protocol, the medical protocol that the doctor is giving to them is personalized to the considerations, and also um, which how many cycles there could be in this process. So this is something that could be really important to do. Another thing that I would like to talk about, sorry, is the ovarian stimulation protocols. So, as you may know, most of the times there are different ways to do this treatment, and the most important ones are described in this slide. They are truly, let's say, advised for patients that has a low ovarian reserve most of the time, and also something that many people ask us beforehand is, what can I do if I've got PCOS? So both of the protocols that I'm showing you here is a general idea of what we do here in Reproclinic. Evidentially, these protocols must be adapted sometimes to some patients according to the specific case. But the main idea would be that these are the most important characteristics of both of them. As you can see here, they take around 10 to 10 to 14 days, and also the start is really related to the cycle. Also, the risk that sometimes is really associated to hyperstimulation is something that we always try to decrease. And in this specific case, what we're always to do is to have a really good response without a lot of risks. And these two protocols are really well adapted to those two requirements. And definitely, as it's here, it's really adaptable to all of the cases. So let's say that it can really give us an idea of how the things would be. Definitely, this is follow up together with some controls, with some ultrasounds, and even with some blood tests. But most of the times, they are really good. They have a really good response. They have a really good, let's say, approach in terms of like how we're going to plan it. And finally, the response in general from the patient is really, really, really good as well. So let's say that this is what we always try to use when we're talking about this type of treatment. And nowadays is one, both of them are really good evidence, let's say, from literature and research. Finally, regarding this specific part, let's talk about a really important concept that I think many of the patients have always listened and they always asked about it, and is the dual stim. Many people ask about it because it has many, many benefits, and it's something that I also would like to bring to this webinar because I think it's important to talk about it. And it's really interesting for patients that has a low ovarian reserve. Why? Because as you can read here, it consists in performing two ovarian stimulations without having to wait for a lot of time, or even without having to wait until the next cycle. Basically, the main idea would be that we're going to approach two different peaks, okay, two different phases of the cycle that are the ones where we are going to have, let's say, the most important parts for approaching also the ovarian phase of the cycle. And then what we're going to take is definitely the classic follicular phase, okay, and then a luteal phase. This is definitely something that you might need to consider together with your doctor. But just for you to know that this is a really interesting idea for many patients, and also it is really flexible in terms of time. So as it says here, in maximize all cell retrieval in the shortest time possible. Okay, so if you're interested in it, you can always ask for it. It is something that nowadays is really well known. Many clinics, specifically us, we like to propose our patients. For example, patients that live abroad and they don't have enough time to stay in Barcelona or even for long periods of time. So it could be interesting in terms of time, but also for patients that they say, okay, um, I would like to do this without losing a lot of time because time for me is really important. I'm this age, or maybe I feel that my AMH is decreasing year by year. So it would be interesting for all of these patients that are also really worried about time. So this is really interesting for you to know. Another thing that I always like to bring, and that many doctors and definitely many scientists talk about, is how can I optimize my quality? So this is something that many patients they ask. Is there any way to improve the quality? Is there any way to keep it? I'm 30. I would like to keep the quality because I know that year by year it decreases. Or even I'm 38, I'm 40, and I would like to perform this treatment, and I'm still thinking about it. But I know that with my age, it could be a bit difficult. So let's say that what I'm going to read to now are some ideas of some research that they've been done during the last few years, and that they've brought really interesting results regarding how to optimize the quality, because it is really important for all of us in the fertility scope that we find some ways to help all our patients to also increase their chances of being pregnant, but specifically to increase the chances to have really good quality embryos. So these three things that you see here, there are some of them, some of the things that I would like to talk to you about. That doesn't mean that are the only ones, but these are one of the most important ones, and also the ones that has a lot of evidence and literature that you can read. So the first of all is coenzyme CoQ10, or CoQ10, the name. It is also sold as ubiquinol, but the most important thing of this is that it improves also mitochondrial function. Okay, as you can see, read here, it is basically what gives the oocyte the energy to keep all the functions it has to do. It is really important part of the oocyte that would definitely need all this energy to do all its to has all its requirement in place. So this specific let's say substance improves all these situations that are related to how the quality of the eggs decrease with the time. So let's say as much as you take it, or as long as you keep taking it, it will definitely help you to keep all these processes that the oocyte does a long time. Okay, the melatonin, it is always it is always sold as something that helps you keep the sleep quality, but it has also been useful for seeing that you can use it as an antioxidant to protect the oocytes. Okay, as you may know, there are many substances in the environment and also even in the food that we take that could be really damaging to many of our cells. So melatonin has been found as a really good way to keep this. It, let's say, fights again these substances that could attack the cell itself. And it may be really interesting because sometimes people that they don't have a lot of time to also like get rest, or that could be under a lot of stressful situations, this substance in general can help you to decrease the risks of decreasing your quality of the eggs by all of these factors that I just mentioned. And also, as it helps with the sleep quality, it definitely sleeps it improves let's say all the benefits that the sleeps can give you. That doesn't mean that sleeping is not it should be something that we need to exchange for this, but it could definitely be a good support in cases you have a lot of stresses, or if you have like daily situations that could give you all of this pressure on. Finally, something that is really important that I always like to bring is diet. Diet is something that, as I just mentioned, that it's really let's say a really important factor when we're talking about fertility. And in general terms, what people always advise you is to consume healthy food and everything. But I always like to, let's say, focus on a specific diet that people can definitely get all the things that they could do. One of them that are always mentioned is the Mediterranean diet. As you may know, this diet is complete. It has a lot of different substances that are really necessary for the body to develop, as well as in this case for the fertility score, give all your cells, let's say, the care that they need, because it gives you a lot of omega-3, folic acid, vitamin D, even coenzyme 10. All of this is something that can be approached from this diet, and that I definitely think it is really well associated with better success rates, and that I always recommend to all my patients to take. If they can follow at least some of these recommendations that the diet gives you, it can be always a good hand when you're trying to increase your chances of having good quality oocytes, and definitely when you are trying to conceive. The next slide is something that I would like to talk to you, because I think it is important to also take out all the misleading information, some misconceptions, even when we're talking about this specific situation. Okay, how can I understand my fertility situation, and definitely what can I expect from the egg freezing treatment? Some of the myths, as you can see here, I just took the ones that I usually listen to all my patients when we are talking on my phone, or maybe when they are sending me some emails and they found some research, or maybe they had some friends that they told them something. So, for example, low AMH means no eggs. That is something that it's the first thing that I put, because it is something that I always try to explain to all my patients. Low AMH does not mean that you will not have eggs. This is something that people need to fully understand, because it means the quantity, okay? But that doesn't mean that we will not have any chances of being successful. It only means that, let's say, it may be necessary to have more cycles, it may be necessary to have another protocol, but as I just said with all the other slides, we can always try to increase those chances. It may not change the AMH, but it may help you to, at least what we can get from those cycles that you're going to perform will help you to have really good quality oocytes that can definitely finish in good embryos, and finally good chances of conceiving. So this is something that is really important for you to understand, and I assure you that here, at least what we'll always try to do is to make you fully understand this process, and also give you all the details about this part. The second thing is that freezing depletes ovarian reserve. So this is a really important question that many people sometimes ask me. How can I have more eggs if they tell me that you have a limit? So the main idea is that naturally all the follicles that you have in every ovary, they are trying to develop, but finally one of them is the one that leads, and that's the one that is going to be the final egg. The main idea of the egg freezing is that instead of only having one, what we're going to do is to make all the eggs that you're having to be mature, and then we're going to retrieve all of them so you can have more chances of having babies. This is something that it's really important for you to understand, because the main idea is that it rescues, let's say, all the eggs that naturally and finally you're going to not use. And then what we are going to do is to take all of them to preserve them, and then in the future, if you would need any help, you can definitely have this support and also this backup that it's from your own body, and definitely from your own reserve. So this is not something that will affect your AMH or even your reserve or anything. It is just something that naturally happens, and that instead of only losing them, we're going to use them for any other procedure. Finally, more medications, better eggs, and processes last only 10 days. These two things are really important things to take, okay? As I said before, there are different types of stimulation process, and also how we're going to adapt them to every patient. But the most important thing here is that this is a medical procedure. We need to fully understand your case, and that definitely we need to take into account many factors that they could be necessary in order to plan any type of treatment. So in this case, more medication, better eggs, it's a myth, okay? It is really important for you to understand that sometimes it might be necessary to increase the dose, but also sometimes it might be necessary to decrease it. And most of the times, the most important thing is to see how your body responds to it. Everybody is different. every response is different. And what we always need to understand is that we will always try to preserve your confidence and finally your well-being. So it is important for you to definitely put your hands into good professionals that can help you to understand the situation and that can give you all the information so you can always feel well informed and definitely have a really good response from the things that you are doing. As it says here, there is a biological ceiling. This is something that many doctors explain in our consultation, but basically the main idea would be that we would not like to have any side effects from them. So we will always try to see how the response is starting from the very first beginning, and then tell you if you should keep the dose as it is, if you need to decrease it, or even if you need to increase it. Finally, the times. So timelines are really important for many patients. As I said, there are many protocols and interesting approaches for people that they are trying to make it happen as soon as possible, but it is always important also to remember that this is a medical procedure. We need to see how your body responds and sometimes even say, okay, let's stop, because it could be dangerous to keep doing this. And then let's try again to see how this is happening. Sometimes it could happen. It is not really impossible, but we always need to take into account all the factors, all the responses, all the results from the things that we are taking from blood tests or even from ultrasound, and then give you all the information so you can definitely understand and of course decide what would you like to do. We will always try to consider all patients' decisions in order to go ahead with any treatment. Specifically with this case, what we always try to preserve, as I said, is the confidence and definitely the well-being of the patient. It may be necessary to take a little bit longer. Sometimes it is necessary to take also many more controls, but this is something that you would definitely be informed when you are performing any type of this treatment. Finally, something that I always like to talk about is lifestyle. This is something that I think is generally spoken when we are talking about health in general, but specifically in reproductive health, it is something that we always like to enhance, we always like to remark, because it is necessary also for you to fully feel capable of doing any type of fertility treatment. Quality sleep, as I said, is important. Melatonin can help you, but if you do really good um, sleep time and also use this melatonin to improve it, these two things are really good tools for enhancing your chances of having good quality oocytes and also having good chances of being pregnant. Avoid tobacco. Tobacco in general is not a good friend for any of these fertility treatments, and it can definitely accelerate ovarian losses. There are many research around this topic, and it may be necessary to do an assessment sometimes if you feel that it could be a problem in your life. So in general terms, let's say it is really nice to have a talk about this with your doctor or your general practitioner, and this is something that could be really, really interesting to talk about. Stress management, we always advise to keep under stress because overstressing situations can be really, really, really impacting in many terms. So we always advise you to, at least during the time that you're doing the treatment, to take your time, have a low pace routine, and then try to keep doing everything that you would like to do, but definitely trying to manage it in the best way possible. And finally, exercise. It is always good, at least after the egg retrieval, we always advise you to, let's say, restart your routine, of course, with some moderation, but definitely once you feel fully okay to restart again, it is really good. In general terms, I think all of these practices that I'm recommended you are good for general health, but definitely as part of general health, reproductive health is something that can be important if you try to apply all of these techniques. As a conclusion, as I said, quality over quantity is something that many patients ask me. I fully understand the situation. I fully understand why you're asking this. But the main goal, as I said, is to have quality over quantity. Quantity is important, but quality is also something that we need to consider, because it is really necessary to fully understand that even if we have a lot, some of them may not be good. And the most important thing is that at least if we have not many, but really good ones, we can definitely have good chances of in the future conceiving or even creating really good quality embryos. And this is something that, as as I mentioned before, in our clinic, in Reproclinic, it is designed to at least give you many good chances, and also to help you out with any questions that you may have. I know this is a topic that sometimes can be interesting to talk about with someone and fully get all the ideas of how to do it. So, in case you have any questions or that you would like to deep dive into the topic, you can always contact us. We would feel definitely grateful to assess you with everything and then ensure you that at least you have all the information by hand. So, as I said at the beginning, I know that many of you had some questions before this webinar started. So I would like to tell you, send us our questions, please. We're not live. I know that many of you, after all this talk, there could be some questions. You could have some doubts about how to do these things. But in the meantime, what I'm receiving all the questions, I'd like to read some of the things that some of you sent us. Thank you so much, as I said, for sending us all your questions beforehand. And then now I would like to respond to all of them as much as I can, just to give you a general idea of how I would like to help you. So Francisca sent us a question saying, how long is it possible to freeze eggs without loss of quality for a later transfer? So as I mentioned in my very first slide, age is something that is really important. Unfortunately, it is part of a biological process that nowadays many scientists are working on it, but as far as we know, we need to consider it when we are doing this treatment. So how long is it possible to freeze eggs is something that is, personally speaking, something that every patient need to consider, something that every patient need to prioritize according to the specific situation. But in general terms, when you freeze them, there is no loss of quality. Okay, once you have frozen them, they keep the same quality that you had when you froze them. And finally, for a later transfer, when you thaw them, you will see that the quality will be definitely good. So this is something that it's really important to consider, because when you do them, for example, if you are 35, it's a really good age to freeze your eggs, even 34 or 33. And when you are a little bit older, you'll see that the quality of these eggs will be the same as by the time that you froze them. So when you are going to do, when you to create embryos and you're going to do an IVF treatment, this quality is going to really help you to have really good chances of a future pregnancy. So in this case, I would tell you, Francisca, that at least if you're planning to do it now and you have the time to do it and you would like maybe to have more information about it, contact us or get some research, send us your questions. There could be other ideas. And then finally, we can help you out to maybe organize a consultation with one of our doctors so they can assess you with all the good information you may need. Okay, Viv also sent us, does freezing ruin chances of fertilization and damage to eggs? Not at all. As I just said, this is a really good technique and a really good practice in general terms to help you keep the quality of the eggs. So with nowadays techniques, in terms of laboratory, we can definitely help you not to ruin, okay, these eggs. And also in general terms, it is really good for like preserving the quality of the eggs. So I think, just to reply in a really sincere way, it is a really good way of keeping the quality of the eggs that you are now collecting and keeping this quality for the future. As I just said also to the other question, it is a really good way to have good chances in the future for a stable pregnancy and really good chances even to conceive. Michelle, still possible have good quality eggs with a woman from 40 years older if they are in very good health? This is a really interesting and important question. Many of my patients come when they are 38, 39, 40, and to all these women that they are thinking about doing it because now they saw that, oh, I didn't know about age and egg quality, and now I feel so under pressure because people is just telling me that I really need to do this. No worries. It is definitely important to prioritize the time and the age, but we will always try, as I said, to give you all the information beforehand so you can definitely do the treatment by that time and then preserve the quality and also give you good chances of having some some good embryos in the future. When you're 40, it doesn't mean that you're not capable of doing this treatment. We will definitely try to help you with all of the information and also a very good protocol that can help you with really good chances of having a lot of eggs and good quality eggs, the most important thing. But it is definitely possible to do it. It is definitely possible. Also, if you follow this webinar and you are this age, be reassured that we will always try to give you all the elements that you will need in order to make it happen. And also tell all your friends about this, tell all your family about this. If they are also considering this part, you may have someone that is always worried about the situation. So tell them that it is sometimes something that can come up to your mind, but it is possible definitely to do it right now. Constance sent us a question that I left it, let's say, for this part because I think it is important also to discuss it. And it talks about if you can get a multiple pregnancy, for example, from this eggs. So I think definitely you can get multiple pregnancy. The chances vary from every patient. There is always a chance of having this. But I think the most important thing here is definitely to preserve your well-being. I think with the doctor, with a really good, let's say, gynecological follow-up, you can definitely be sure that if that's your desire, there is always a person that can assess you with more information about the chances. And finally, it is always important for you to know which are all the implications of this procedure and definitely their circumstances. So I think there are definitely a lot of chances of having a multiple pregnancy, but this must be assessed definitely by a doctor and also by doing some follow-up with your general practitioner or the person that is following you on doing this. So Luis Sanchez question that it's really important because it is related to one of the slides that I just had. How to increase ovarian response for diminished ovarian reserve or low AMH in over 40s. So as I just said, ovarian reserve is something that may decrease with your age. Okay, it may decrease a lot or a few year by year, and sometimes the response is something that we would definitely need to see according to how the protocol is done and definitely how the response of everybody is also doing. So I think the question here is very related to what we were speaking, and I think the most important response would be there are that many ways of trying to preserve the quality year by year. So the sooner you start to do all the things that I just told you, the better will be the response. Okay, the supplementation is really important. The good health lifestyle is also very important. But definitely, if you are trying to prioritize this fertility pathway during this year or even in the future year, if you're thinking about doing it, I definitely propose you to think it in a very serious way. And then if you have questions, definitely tell the professionals to give you a good assessment about it, to respond to all your questions, and finally to help you out with anything that you may need. And the final question that we just received is related to FSH. I'm going to be honest, this is something that could be particularly important to speak with the doctor because hormones in general, they are substances that need to be followed up and also, let's say, control with an endocrinologist or maybe with a gynecologist. So in this case, Roman sent us a question, how to diminish FSH. I would tell you that in this specific case, I would consider going to maybe see your GP or your gynecologist. Maybe he or she will send you some tests to see what's going on, also to contrast it with other factors, and then ask you a few questions regarding your um, any other health issues that you could have, and then in that case see how we can help you if there is anything related to fertility, for example, to AMH or any other response to your system that may be affected. Then that person may definitely propose you to go to some fertility to take some fertility assessment, and definitely search experts to help you out with this specific situation. So, as I just said, I was more or less replying to the questions that some of you made us arrive. I know that you would like to, and then give you all of the response that you may need. Thank you so much for connecting. I'm still finding out some of the questions that I just told you are really, really, really present in many of my patients' questions. Okay, many doubts that they are always addressing to me, and that I always like to respond to them in a really sincere way, but also in a really informative. So all of you can take your decisions with all the tools, all the elements that you need to take into account before you actually start all of this treatment. So let's say I was also trying to see here if any of you would like to talk about anything else. I would like to also focus in a very specific thing that I was also commenting, let's say at the final part of the slides. Um, let's talk about how important it is to do it in one age or the other one. So as I just mentioned before, the graphics are really well related. The quality of the X decrease also with by the time, but it is really important for you to understand that there are many techniques, okay, that we can use afterwards to also address which is the quality of the future embryos that you're going to create. Unfortunately, nowadays, many people ask me, is it possible to test the eggs to see how the quality is? Unfortunately not, okay, because there are many specific situations related to the techniques that we are using nowadays in research and also laboratory. So this is very important for you to understand that the data that we are managing nowadays, according to the literature that we more or less all the consultations and clinics in general we have, is that the age is related to the quality, and the age is also related to the ovarian reserve. But these two things, they must be addressed according to more or less how we have our lifestyle, if there are any diseases that we are going to address to our practitioners when we are having a first consultation. Also, if I have my controls year by year with my gynecologist to see how this is going, if you have had any, let's say, situation in the past that could affect your gynecological, let's say, general situation, and definitely if you have had any other problems maybe in your family that could be genetic, this is something that sometimes could be related. So every person is different. I think it's important to also mention that here in our clinic, we always try to study all these cases, okay? We don't leave anything for a general case, not at all. We always like to know everything regarding your medical history, so you can definitely have all the information, and we also have all the information to know more or less which is the best way to approach your specific case. So we can always have a very good result when we are doing this treatment. So another question that I would like to address now that just came up to my mind, something that my patients always ask me is, are the hormones that I'm going to use, for example, now that I just mentioned the protocols, are these hormones going to be damaging? Are they going to affect also my reproductive system? Is there anything that I need to know because maybe in the future I will have more problems to do this or that? Not at all. Not at all. You don't need to worry about this. There could be some side effects that we always like to mention when we are having a consultation, but any of them should damage your reproductive system. Any of them should damage your response in the future. If, for example, you would like to naturally conceive, any of this should be damaging. But all definitely, There could be some things that could be a vary from patient to patient, some side effects that we need to address sometimes. And definitely what we always tell all our patients is that please tell us if you're having any pain, if you're having any difficulties to do anything, so we can definitely advise you any other thing or may give you some other medication by the time. But the general response should be comfortable. Also, the response is varied. It could be different from every patient to every patient. I've had some patients that they had a really good response, really good result, and finally the next day they feel really good. But other ones that they may need some other follow up because there are other things after the egg retrieval that needed to be addressed. And also, definitely, what we are always going to do is to help you out to see what's going on. Maybe give you some medication in case the ones that we just prescribed you is not the best, and then try to do a follow up to see if everything is able, let's say, evolving in the way that it should have. So until now, I think more or less this is a general idea, okay, of all the things that we are more or less doing here in the clinic. Also, I gave you some other tools so you can preserve the quality of your eggs. If you are 30, if you're 35, think about it. If you are collecting some information in order to proceed with it, don't worry, take your time and everything. For the people that they are still wondering if they have still the possibility of doing it because they feel that with 38, 39, 40, it's a bit late. No worries. It is not late. It is something that you can definitely do. Would definitely advise you to do it. Um, let's say trying to help and assess your situation for getting better results. This is something that we would definitely like to do. Okay. Um, Olga sent us a question that I would just like to read from YouTube. It says, could you tell me more about protocols with patients with deep endometriosis? So I would like to go back to the slides so you can see a bit more about how we talk about this part. So basically, the general idea would be that these two specific protocols that I just told you, um, they are well described in the literature and they are really good for this type of cases. For example, low bound reserve, PCOS, and sometimes the type of endometriosis we need to assess it as well. There could be some questions from the doctor to see how you which medication have you taken, or maybe how you gynecologists have tried to control it. So according to that, we could approach some of that medication also to see what we can do, or even maybe give you a protocol that is well adapted to your case, all the types of administration, etc., etc. So in this case, I always tell my patients that they bring me some of their concerns about endometriosis or PCOS, or maybe because they have had some gynecological problems before with maybe contraceptive pills that they could give them some migraines or even like other side effects. It is important for you to know that this type of treatments should not affect that, and then we can definitely try to see how we can help you. Um, Sometimes it would be necessary to see which is the first result. This is something that it's important to be sincere about because we need to assess how the response is according to what we get in the first cycle. So it could be necessary to have some tests, to have some reports from your doctor, and definitely see how we can proceed with the treatment. And this is something that is also very important to know before you actually, for example, do an IVF treatment. Even in the future, you would also like to have some chances of getting pregnant. So, Olga, I hope that at least the response was clear for you. In case you have any other questions, please um, don't hesitate to call us to also ask for any other thing that you might need, some other information. Maybe even a doctor, one of our doctors can help you out. They are very well informed with all the situations. So in case that you would need any medical recommendation, we can definitely try to search a time slot for you and give you all the details about your specific case. Um, if you can send me all the questions, I'm here to explain you everything regarding this part. I know that many of you also are interested in this situation. I know that was some registered beforehand. So if you would like to send us anything that could be interesting for you to ask, or maybe to get some other information because someone gave you this and you would like to contrast it with the things that we are saying now, please send us all the information and we will be pleased to just respond to all of it. Okay. um I don't know if any of you may have something else, just so we can talk about it, um and then definitely explain you a little bit more of questions. So I would like to maybe give you some opportunity to do it. I know that we are now live on Instagram, now on YouTube. Again, thank you so much for your time. Thank you so much for being connected. I hope that at least all the information that I gave you, as I said, you can use it. Also, if you have more questions, please don't hesitate to contact us. Don't hesitate to ask for anything that you feel concerned about. And definitely, we can propose you a call or even a first consultation with the doctor if you have some results that you would like to contrast, or that you would like to get more information about your chances, about how we would like to approach this situation, maybe to do a medical protocol. And finally, if you are trying to prioritize this year to do your egg freezing, do it. I completely address it to all the patients that I always have every day, and that if they are interested in doing this process, take your time. But definitely, if you're thinking about it because you would like to have more chances, this is the right time to do it. So I think until now, Olga was our last question. Um, yeah. So thank you so much for your time. I think it was really good to have you here today. In case you have any other questions, please do not hesitate to make us write all of them, and then please do not hesitate to contact us. Feel very, very, very free to send us a formula, or maybe to send us an email to get some contact from our part. And then finally, I would be pleased from Reproclinic and also personally myself to help all of you to assess your specific situation. Thank you so much for your time. I hope that you have a really lovely evening, and then I hope to see you soon. Bye bye.